they fall into two categories. You have the patients that don't have insurance, and they just need some type of surgical care in the case of ear tubes or whatever that might be. An ear tube or colonoscopy or hernia repair or gallbladder removal. They fall into two camps. One is the camp of, I just don't have insurance and I need to get this done. I'm willing to pay for it, but I just cannot afford, in the case of gallbladder, lap chole, 1 hour procedure with about an hour recovery that involves a couple small 1.5 centimeter incisions. That cost is $22,000. Well, I say that cost, that is the, after negotiated discounts, the reimbursement rate to the hospital for that procedure. 2 hours of facility time, an hour of surgery and maybe an hour of recovery for $22,000. Our cost is $8,300, $8,400 for that same procedure. And so the patient can't afford $22,000, frankly. So they just deal with gallstones, and eventually they end up getting, gallstone pancreatitis or other complications related to it. And so that's camp one. Camp two is the people who know that they have health insurance. They pay for it every month. They are relatively healthy families and they don't utilize it. They say, hey, I'm paying $1,000 or more a month for a family plan, and I have an $8,000 family deductible. I go see my PCP when I can get in, and I use up maybe 5 to 10% of my deductible every year. It's now November and I need surgery, and so I need a hernia repair. Well, in that situation, if they have an $8,000 deductible, that hernia surgery is going to eat up literally every single dollar of that $8,000 and then some, in the current health systems. So they're going to pay almost $8,000 out of pocket. In our case, I think most of the, depending on the type of hernia, they're going to save $3,000, sometimes $4,000 off that number. So they might choose in November, December to pay $5,500 at Wellbridge, knowing that their deductible is going to reset in January anyway. Right. And so they just save themselves $3,000. They know that they're unlikely to need another surgery in the next few weeks. And even if, in that scenario, you're really functioning kind of out of network, but it only makes sense to do so because they've looked at the numbers and they've, kind of realized that I don't utilize my healthcare plan and I don't want to because it actually is not really providing the needs that I have.